Okay. Hi, everyone. I am Maggie Sanchez, your Chair for Education Committee. I'm super excited to bring back Ariana Golchin. We had her, I think it was last year, and she went over, mental health and how it's normal to feel certain ways. And we did amazing exercise, and that's what I'm looking forward mainly today. So for those exercise, I just feel like it's a breath of fresh air. So I'm super excited to have her back. Thank you so much for your time and for being here with us. So I'll let you take the floor.
Thank you, Maggie. It's so great to be back. Hi, you guys. Is my audio okay? Can you hear me okay? Okay, I have headphones in, so I just wanted to make sure. Hi, everyone. Thanks for being here. Apparently, it's really nice over in California with the weather, so I appreciate your time. If you have to jump off, that's fine too, since it's being recorded. Just take care of yourselves today. So as Maggie discussed, we're going to be talking about mental health awareness. If you attended the last lecture I gave in the fall, there is going to be a little bit of overlap in material, so I apologize. You can take a little snooze if you remember it, whatnot. But we're going to dive in a little bit further with ways to get connected with mental health help and how you can really get started and navigate the process, because it can be overwhelming, especially with all the professionals out there. So a little introduction about myself. So I am a board certified PA, so I'm a medical provider. If you aren't familiar with what a PA is, in summary, we treat, we diagnose, we prescribe, and oftentimes we serve as patients' primary or principal providers, which is pretty awesome. I was practicing at the University of Utah Neuropsychiatric Institute on an acute stabilization unit, but now I'm going to be starting a new position in burn and reconstructive surgery. So it's going to be a little bit different. I'm really excited because there is a ton of underlying mental health within this specialty. So I think it's a nice combination of integrating my passions. So a little bit about my role in psychiatry, spending the last two years there. So I had the privilege of taking care of patients with many diverse backgrounds, psychiatric conditions. I managed everything from suicidal ideation, anxiety, depression, acute psychosis, substance abuse, withdrawal, just to being there, providing that safe environment, and helping patients through whatever it was they were going through. So I have a huge passion for mental health. It is one of my favorite things to discuss. I spend a ton of my time outside of work involved in advocacy projects. My goal is to really help educate others around me to emphasize and recognize the importance of mental health and promote destigmatization. That is a huge issue that we deal with and a big concern nowadays. So you guys are going to have access to this recording. This PowerPoint also will be emailed to you. So don't stress too much about writing notes. Just kind of relax and be present. I'm really excited to be here. So thank you again, and we'll jump in now. So what is mental health? I think when we think about mental health, so many things come to mind. It can be overwhelming. It can be something negative. It can be something positive. So mental health is our emotional, psychological, and social well-being. It affects how we think, how we feel, and how we act. And it helps determine how we handle stress, how we relate to others, and how we ultimately make choices. So who does mental health affect? I think we all have had at one point or have, I know society has a stereotype built up in our heads with whom we think mental health affects, or what someone may look like if they are suffering from a mental health condition. But plain and simple, everyone. Mental health affects everyone. Every single individual is going to experience a mental health related complaint at some point. It's not a matter of if, it's a matter of when. So bottom line, mental health does not discriminate, and I think it's really important to talk about these things and create that safe space so that you guys feel comfortable and empowered to talk about mental health as well. So this slide we are going to dive into, it may provoke a lot of emotions. 2020 was a year. Every single one of us was affected in one way or another. It was very difficult. And as a realtor, you guys already experienced tremendous amounts of pressure and stress every single day, just in your career alone. And then when you add in, personal matters, recovering from the aftermath, or trying to recover from the aftermath of 2020, it can cause a huge challenge for us. It's a lot to process, and it is a lot to handle. So maybe you aren't handling it, and that's also okay. We're going to talk more about this and how you can either work through it or how you can go about getting connected with someone who can help you. So this picture here, it just reminded me, I love this picture, I use it all the time, but it reminded me of 2020 because it was so difficult. You know, you see the sunshine, the beautiful part on one side, and then you see something that looks a little bit dark and dreary. And I think those are aspects that often are incorporated into our lives. So I've listed some of the big examples that came to my mind of how our mental health has been impacted last year and continues this year. So the global pandemic, we are still in the thick of it. It is still very challenging, and it's caused a lot of trauma for every single one of us. It's not just those who have, been affected by it, who have gotten it, or healthcare providers. It is every single person, and I think that's important to recognize that. There has been a lot of racial inequity and injustice. This has been a very difficult time as well. Changes in the education system. You guys may be homeschooling your kids. Maybe you have a program or whatever you're engaged in is half online, half at home. And so routines are getting shifted. Employment, a lot of people have lost their jobs. They've been furloughed. That is very, very difficult. And like I said, just shifting in our daily routine. We're not really able to travel. Social events are limited. We're not really seeing our friends and family the way we're used to. And just accessibility to resources has also been decreased. It's just been disappointing at times. And I think a lot of us have experienced social isolation. It's that lack of human connection that we crave and that we need to function as humans. So let's talk about the role of stigma in mental health. What does it mean? Why do we care about it? So this is something that we all need to really keep in mind. So number one, we need to be open and vulnerable with how people are feeling, okay? And number two, if someone's willing to seek out treatment or help, these are some things that often affect the stigma. So society has continually put us down for being open with any kind of mental health related concerns, anxiety, depression, substance abuse, you name it. We're often ostracized and perceived as weak, attention seeking, drug or motive seeking. I'm sure you guys have all heard that term, drug shopping, all of those really hurtful labels. In reality, mental illness is a medical condition. Mental illness should be treated absolutely no differently than a heart condition or a broken bone. All conditions are going to be requiring attention, patience, understanding, and that patient-centered care. So, one of the most important things I like to remind my patients, my family members, my friends, really anyone, is that no matter what an individual is dealing with, they are not their diagnosis. They are not depression. They are not anxiety. They are not psychotic. They are simply battling XYZ, okay? Whatever that may be. Labels and stigmas hurt. And that's why I'm so passionate about this, is because I want to break this stigma. I want to have these conversations, and I want to invite you guys to be able to have these conversations as well. So this is a little bit more applicable to you guys. This is a little recap also from the fall. So over the next few slides, we'll be recapping a little bit. So let's talk about your positions working within real estate and the correlation or impact it may be having on your mental health, especially right now, especially all through 2020. So according to this figure that was put out in a research article, real estate is actually ranked number 2 for the highest profession associated with depression, right below public and private transportation and above social services. So you can see that with that arrow right there. So as you guys know, I work in healthcare, but I can only imagine the toll that being a real estate agent may take on each one of you. It's a lot. And it also probably takes a toll on your support team. So you guys are very, very busy. You're very, very involved, very determined, and always on the move. So some examples that came to my mind that you may be experiencing within real estate are listed on this slide. I'm sure there are plenty more that come to mind when I'm reading. So like I said, demanding, stressful, long hours. It's competitive. You guys have to be so happy and upbeat all the time. That is exhausting. That is exhausting. anxiety, fear, managing so many clients at once, trying to keep track of sales, all these things, and income can be dependent upon your sales. So my goals for this presentation are to, 1, help bring awareness regarding mental health. Number 2, I want to address the impact that this past year may be taking on each of you, and then provide you with some tools and resources to get through it. Number 3, I want to discuss various professionals and their treatment methods and scopes of practice within the mental health setting, because like I said, it can get very, very tricky when seeking out care. You don't know who to go to. You don't know who does what. And I think that we as medical professionals need to do a better job at simplifying things and helping and providing those resources to really help people gain that access to mental health care. And number 4, I want to be able to provide some encouragement and motivation. And lastly, number 5, I will answer any questions that you guys may have. If you don't want to ask it on the Zoom, I'll be giving my email. You can email me. I'm more than happy to talk to you. Okay, so some more real estate related content. So this is another important piece regarding your career and the additional stress that you may be experiencing. So I spoke with some friends who are realtors, and they had mentioned the prevalence of violence that exists toward real estate agents. I think that's something that's not probably talked about a lot, I think it's also very easy for others who are not in your career to look in from the outside and think how glamorous being a real estate agent is. Make your own schedule, get to meet new people, money, when in reality, like, that is not what it is. There's so much more than that. And that's always how things are nowadays. People look from the outside in, and they have no idea what you're actually dealing with. The truth is, it's far from that, or at least I would assume you guys are probably always working in a sense all the time. You have to be extremely flexible to adapt to your clients' availability. You have to meet new people each month, every day, every week, and your impression matters. You have to go all in, you have to fully commit. And like we talked about, being charismatic and essentially performing, that is exhausting. Okay. And while there is great money to be made, it doesn't just fall into your guys' lap like everyone assumes. You guys have to work very, very hard to cater to your clients. Oftentimes, it's probably out of your control if a sale falls through or if a client decides to walk away, some unknown reason, even though you were showing up and you were giving it your all. So in this graph, you will see with this red arrow, this is some more data for the 2019 National Association of Realtors Safety Report. It's showing that 33% of realtors had experienced some type of situation that made them fear for their personal safety or the safety of their personal information. And for me, 33% is too much. Okay, I feel like that number is still quite high. Bottom line, you guys all still go through so much, and oftentimes you're dealt very difficult cards. So let's talk about some problematic behaviors from clients that you guys may experience. So expanding on this, working in psychiatry has exposed me to a lot of different types of personalities. It's placed me in situations where my safety could have been jeopardized, and it could have gotten very, very dangerous. There have been some close calls, and I'm sure each of you have had encounters that have been similar. Maybe clients are harassing you, maybe they're stalking you, maybe they're having inappropriate behavior towards you, or perhaps maybe you've been taken advantage of or manipulated in hopes of, making that sell. Maybe your clients are like, if you meet me over dinner, then we can discuss the house. Things like that, where you feel like you have to show up because your career depends on it, and it's still uncomfortable. So all of these types of unfortunate situations can ultimately take a huge toll on your mental health. They all add up. And we know that how we are doing emotionally is going to affect us physically, and that can be very difficult to cope and work through. So how can you guys prioritize your mental health? What can you do when things get messy, when they're overwhelming, when they're difficult within your career? This one is really, really challenging, but having or learning to create boundaries, it's tough. It really is. Recognize the potentially negative effect on your mental health and then your physical well-being. So just recognizing is the first step, and that can be really hard. understand or try to learn when it's time to walk away from that situation or sale. I think it's so easy to just nearly work ourselves to death. I've been there. Last year, I absolutely worked myself to death. It was not pleasant. We tend to continue to show up and push and push and push because we've invested so much time already. We're so close to hitting our goal. We're so close to that finish line. But if the situation is toxic and really damaging your mental health, you have to walk away, or at least learn to begin to process how to walk away. I like to think of this like a slot machine or gambling. If you're familiar with gambling, maybe you're at the blackjack table and you're up all this money and you're winning, but you need to know when it is time to walk away before you lose everything and before you end up in a really dark place. So what can one experience when mental health is declining, when it's unstable, being provoked by difficult life circumstances? Sometimes we feel fear. We're worried, we're anxious, we can't sleep, we feel really sad, feel hopeless. We are not motivated to save our lives. Even getting out of bed is a challenge. Okay, maybe we're angry, irritable. Maybe we are in constant panic. Maybe we are isolating from people we love. We're not picking up the phone. Our phone's always on silent, or so we say, things like that. And maybe we're getting to the point where we're having suicidal thoughts. Maybe we're wanting to harm ourselves. Maybe we can't concentrate. So I want to talk a little bit more about this. So if you're feeling a certain way, is this normal? When should you be concerned? Okay. Everybody is going to cope differently. Everyone's threshold or, what they can tolerate, how they manage it is going to be different. Feelings that were listed on the prior slide can be very, very normal. They feel uncomfortable and they don't feel normal because of what society has programmed us into thinking, but they can be normal. So the question, you guys, when should a person consider seeking out help and treatment? When is it too far? What are some warning signs to watch out for? So if someone is, not physically taking care of themselves, they're not showering, they're not eating, they're not showing up for important obligations or responsibilities. Maybe they're having those passive or active suicidal thoughts. Maybe they're coming more frequently. Okay. Maybe there is some substance abuse or engaging in risky behavior because the person is trying to cope with the difficult situation. Not allowing oneself to be with their own thoughts. So they're always distracting themselves. They're always on their phone. They always have to be doing something to make that escape. Or maybe someone simply just wants to improve how they feel. Maybe they just want help. You don't have to have a reason to seek out mental health help. And I think that's another thing that we really need to be better as a society at helping others with. Therapy is not bad. Therapy is good. Medications, if you need them, take them. You don't have to be, quote, sick or depressed to benefit from therapy. It can be very, very useful in our everyday lives. So this next part I have definitely been guilty of, especially over the last year working in healthcare during this very chaotic time. When you're placed in a stressful and demanding environment, you learn to adapt. The unbearable stress, the pressure, the guilt may become your new normal, and you don't even realize what's happening anymore. It's very problematic because you reach a point where you're not phased anymore. Or maybe it's finally too much and then everything just gets unleashed. The monster, whatever you call it, all hell breaks loose. You don't want to reach that point where you end up in that place that you never intended to be in. So it is never too early to seek out mental health help. And like I said, there never needs to be a specific reason to do so. You do not need to explain yourself to anybody ever. You do not need a reason or an excuse. So let's talk about treatment. Like I said, this can get kind of confusing. It's like, where the heck do I go? Who do I see? What can they help me with? What do they do? Do the same people who do therapy prescribe meds? So this is where some proper education and just taking the time to walk through it with each of you can be pretty helpful. I know that before I worked in medicine, I had no idea Still, it can get a little bit confusing. So let's start with our primary care providers. So these are like the providers you would go see for your annual checkups when you have a cold, maybe you sprained your toe, any kind of general complaint, if you will. So talking about medical doctors, so physicians, these are our MDs or our DOs. So primary care physicians can prescribe psychiatric medication, but you might consider visiting someone who specializes in mental health care. Primary care and mental health professionals work very closely together to get you the right course of treatment. So then we have our advanced practicing providers. So that is me. So PA, family nurse practitioner. So maybe you guys have seen one or the other. So we are able to provide general medical services just like the physician. We are able to prescribe psychiatric medication, but like I said, you might want to consider seeking out specific mental health prescribers. It just depends on the situation and the extent. So these providers, so primary care providers, are really good for basic psychiatric complaints. So depression, anxiety, insomnia. They do not do therapy, just medications. So you say you trial some medications out and you're like, it's kind of helping, but it's just not enough. And so primary care is doing more and more and more, and you're still not getting relief, or maybe things are getting a little bit more complicated. This would be a really good time to transition to someone whose expertise is in mental health prescribing. So we'll talk about that. So we're going to talk about mental health specialized providers. These providers prescribe psychiatric medications. They are the experts in mental health. This is their everyday patient population. They're very comfortable with complex conditions, things like that. So back to physicians. So these are referred to as psychiatrists. You guys might be pretty familiar with that term. Psychiatrists, they have graduated from medical school. They did a psychiatry residency program. They assess, they treat, they diagnose. They can do therapy, but most do not. Most stick to strictly medication, and then they'll refer you out if you would like therapy. And then back to our advanced practicing providers. So these are advanced psychiatric nurses, and then our psychiatric mental health nurse practitioners. Huge mouthful. So they hold a master's degree or a doctorate in nursing, and same thing, they can assess, they diagnose, they treat, and they do therapy. A lot of nurse practitioners actually do therapy, which is really neat. So there's those options. And then we have PAs, which is what I was doing. So I have a master's degree in physician assistant studies. I treat, I diagnose, I prescribe. I do not do therapy. We typically do not do therapy in the mental health setting as a PA. However, we're going under some legislation changes to kind of help promote that so we can increase accessibility to mental health care. So to keep it simple, primary care are just going to do basic psychiatric complaints, and then the experts are going to be able to do complex conditions, but probably more so stay away from therapy. It's very dependent. So let's talk about how we do get therapy. What is therapy? Why do we care? So therapists are going to help an individual better understand and cope with thoughts, feelings, and behaviors. They're going to be able to offer that guidance, improve a person's ability to achieve life goals. So that's why we don't need necessarily something difficult in our life to go to therapy. You can go anytime. These mental health professionals may also help assess and diagnose mental health conditions. So here's where it gets a little bit tricky. So bear with me. So who does therapy? On TV, we hear counselor, we hear therapist, we hear so many different terms, and that gets really overwhelming for people, especially who do not practice in mental health or medicine in general. So I want to make this as simple as possible so that you guys feel good about it if you want to seek out therapy. So the first one is a psychologist. So they hold a doctoral degree in clinical psychology or other specialties, such as counseling or education. They are trained to evaluate a person's mental health using clinical interviews, psychological evaluations, and testing, so they can actually diagnose and provide individual and group therapy. So the next we have counselors, clinicians, therapists. So they also hold a master's degree. They're trained to do similar things. They use therapeutic techniques based on how they've been trained, and they operate, like I said, under a bunch of job titles: counselor, therapist, all of those things. So their treatment is going to lead to a reduction in symptoms and really just promote that positive thinking and how one is living and feeling. So the next one is a clinical social worker. Okay, they also hold a master's level degree, and they're trained to evaluate a person's mental health and use those therapeutic techniques based on how they were trained and what program they went through. They also are trained in case management and advocacy services, so they can do a little bit more. It's a little bit more diverse. So many resources out there for therapy. Everyone's specific needs are going to be a little bit different. So if you're feeling overwhelmed with life in general, where can you start? As we move through these next few slides, I want to discuss some options to really help you work through those stressful, high anxiety driven, unmotivated, sad, want to rip your hair out times. So the first one we're going to talk about are the meditation apps. These are just some of my favorites. If you go onto your app store on your Android, or if you're an iPhone user, so many will pop up. So some of my favorites are Headspace, Calm, Insight Timer, Aura, and then the rest just listed below. So whatever you like, you can just try them out, see how they feel. I did that before. I was looking for like a nighttime meditation app, and so many of them were just kind of odd. So there is plenty of variety for you guys to find something that fits your needs. So next we're going to talk about coping skills. So what is a coping skill? A coping skill is a way to help you tolerate, to minimize, and really deal with those stressful situations. So many of you are probably already utilizing these techniques listed on this slide in your daily life, or maybe you have others and you don't recognize that it is a coping skill that's helping you get through. So we have emotional and problem-focused examples. So exercising, writing in a journal, drawing, taking a bath, cooking, engaging in a hobby, reading a book, meditating. These are all coping skills. Or the problem-focused are learning to manage your time better, establishing healthy boundaries, engaging in problem solving, creating a to-do list, literally anything that makes you guys happy. So my coping skill is definitely CrossFit. I've spent a lot of time in my gym, especially after working those heavy hours in psychiatry last year. That got me through. It was very good for my mental well-being. So be thinking of coping skills that you guys can rely on, and maybe you need to, dig a little deeper and create some more to help out. That's totally normal. So after listing off some of those coping skills we just talked about, I want you guys to just take that actual few seconds and think of what you do or what you can do. Or you can get to it later. That's fine too. So the next technique we're going to talk about for those really difficult times are grounding exercises. So grounding exercises are things that you can do to bring yourself into contact with the present moment when you're feeling overwhelmed, stressed, or you just need that minute to pause. They can be very quick strategies like taking 3 deep belly breaths, or they can be a little bit longer and a little bit more formal, like some type of guided meditation. So you can use the 5, 4, 3, 2, 1 method or others listed on this slide. So I love the 5, 4, 3, 2, 1 method. You can do it anywhere. This might be pretty convenient for you guys if you need to hide out in a closet or somewhere safe when you are giving a tour of a house or some other very important job that you guys do. So you are going to list off in your head 5 things that you can see just by observing the environment that you're in. 4 things that you can feel, so do you feel your hair weighing down on your shoulders, or, do you feel your hand brushing up against your pants, things like that? What can you feel? 3 things that you can hear, 2 things that you can smell, and 1 thing you can taste. So that can kind of just help bring you back to the present moment and give you a minute to just process what you're going through. I like to close my eyes and think about New England. It's my favorite place in the world. I love the fall. So that's my happy place. That's where I go to when I need to ground myself. So let's talk a little bit about mindfulness exercises now. Some of you may do these frequently. Maybe you enjoy them. Maybe you absolutely hate them. It's very person dependent, but there are things out there that works for everyone. So you don't have to like them if you don't want to. So there's a lot of research out there as to why and how mindfulness can be pretty beneficial. So it's going to lower your blood pressure. This is going to overall, decrease that risk for any type of heart problem that can arise. We want those healthy hearts. This is going to help decrease those stress levels. Okay. Stress can have a huge negative impact on the body. Our immune system is getting shaken up. We're not sleeping, changes in our sex drive, muscle pain, tension, headaches, fatigue, other serious health problems, stress. I know it's like part of everyone's everyday normal, especially lately, but it adds up and it can be quite damaging to our health. So I have listed out some different mindfulness exercises for you guys to refer back to or explore if you are wanting to. So there's the breath, the body scan, object meditation, mindful eating, or walking meditation. Or if none of these feel quite right, you can Google it, and I think more than you would like will probably pop up for some options. So we are going to do some square breathing. So now, we're going to take those few minutes, and this is one of my favorite exercises because it's short, it's effective, and it's very simple. This is for those times that you've nearly had it, and you're about to just snap, and you need to just step away for a minute and just take a minute. I actually did this today. So I am home taking care of my mother. She had a total knee replacement yesterday. It's been a little bit hectic here. I definitely did some square breathing today because we need to practice what we preach, right? So these can be so helpful. So I'm going to talk to you a little bit about what square breathing means, and then we'll actually do it. We'll try it out, see how you like it. So square breathing, like I said, can be pretty helpful to calm yourself down when you're stressed, when you're overwhelmed. You just need that minute before you need to respond to a very high stress situation. When you're trying to sleep, you need to just clear your head if you're in a meeting for work, or maybe just to set the intentions for your day or make a big decision. So the setup for square breathing, it's usually a pretty good idea to sit in a chair with your back supported, both of your feet on the floor. Really feel that support of the chair and the floor underneath you. So I would assume most of you are sitting in a chair. If you're laying down, that's also fine too. Or if you're standing up, whatever's comfortable for you, because I want you to be comfortable. The most important thing is that your body is open to really allow the breath to flow freely. So I want you to also set an intention or an image. You might want to set some type of intention or invite a neutral, positive image to focus on during this breathing exercise. There's a little square you see on this slide. You can actually visibly picture that square in your head as we go through these exercises. Okay, so think of your happy place or think of an actual square. So how do you actually do square breathing? It's pretty simple. So we're going to go through a series of inhaling through your nose, holding that air, exhaling through your mouth, holding again after you have exhaled all of that air, and we're going to repeat it a couple of times. So we are going to begin by slowly just exhaling all of that air. Okay. So now that you've exhaled all your air, I want you to gently inhale to the count of 4. So 1, 2, 3, 4. We're going to hold it. 1, 2, 3, 4. Exhale it. 1, 2, 3, 4. Now we're going to hold. 1, 2, 3, 4. So it's kind of helpful if you create that square image in your mind and you think of each corner with each count of 4. 1, 2, 3, 4, 1, 2, 3, 4, 1, 2, 3, 4, 1, 2, 3, 4. So let's go ahead and do this a couple of times now that you can kind of know what to expect with the square breathing. Okay, so gently inhale. 1, 2, 3, 4. Holding. 2, 3, 4. Gently exhaling. 2, 3, 4. And hold. 2, 3, 4. Let's do one more. Gently inhale. 1, 2, 3, 4. Hold at the top. 2, 3, 4. Exhale, 2, 3, 4, and hold. 2, 3, 4. Good. So pretty quick, pretty effective. You guys feeling okay? Is anyone lightheaded? Did I make you hold it too long? So that is square breathing. I love it. It's simple. You can teach it to anyone. You can do it when you need to. And it works really nicely. So the next one we're going to try out, I actually haven't done this one in a group before, so I would love to see what you guys think of it. This is a 3-minute breathing exercise. So unlike meditations or body scan, like I said, this is 3 minutes. It's also very quick, not as quick as square breathing, but it can be very effective in really getting that mindfulness and that headspace right when you need to. So with meditations and body scans, thoughts are going to be popping up. I know that my mind goes like 1,000 miles per hour, and I'm always thinking about something when I'm trying to like calm down. So let's just do our best to keep your head clear. It can be challenging, like we all know at times. So this exercise is going to be broken into 3 sections. It's going to be 1 minute each. So I'm going to kind of explain. So the first minute is going to be spent on you guys answering this question in your head. How are you doing right now? Okay, I want you to focus on feelings, thoughts, sensations, anything that arises. So let's close our eyes and take a minute to do that. And I'm going to get the timer ready. So go ahead and close your eyes. So how are you guys feeling today? How is your body feeling? Are you relaxed? Are you tense? Are you fatigued? Is your mind heavy? Are you happy? Are you nervous? You know what's going on in that mind today. So I want you guys to just let your thoughts flow freely and allow yourselves to just be. And just keep focusing on that with some nice deep breaths. Okay. Couple more breaths. Good. Okay, go ahead and exhale that air. So the second minute, we are going to work on keeping awareness of our breath, keeping our eyes closed, keeping that body nice and relaxed. We're going to continue breathing and just really focus on our thoughts and attention. Keeping that mind quiet can be rather challenging, and wandering thoughts are going to come. So the idea is not to block them, but rather to let them come into your mind and then disappear. Just try to observe them. Okay, so let's get going with that. So nice deep inhales and exhales. Really try to expand and fill those lungs. Nice deep breaths. Big exhale and breath in and out. Good, good. Okay, so the last minute is going to be used for an expansion of attention outward from the breath, feeling the ways in which your breathing actually is affecting your body. So I want you guys to focus on how each breath is allowing or impacting the way you feel. Okay? So go ahead, close those eyes, take a nice deep breath in and exhale. See how your body feels when you're breathing deeply. Is your tension subsiding? Are you feeling lighter? Are your thoughts calming? Just pay attention to your body and see how it feels when you're taking those nice deep breaths. Take a nice deep breath in, expand those lungs, and exhale all the worries, all the negative thoughts, all the stresses that you have been dealing with today. Do one more breath in, breathe in that positivity, and we're going to exhale all of the worries from today. And just feel your body relax. Good. Okay. So that is the 3-minute breathing exercise. Hopefully you guys are feeling a little bit better. All of these exercises mentioned can be used to really just benefit yourself, to benefit your clients, even in group settings. You know, you can teach your family, teach your friends about them. You know, some are going to be better suited than others depending on the situation. So it's really important to just stay open-minded, trial and error, and just find what works for you when you need it most. The most important part of mindfulness is to recognize that it is training the mind, and that is hard. Our minds like to do what they like to do, and training them can be difficult, especially when we live such busy lives. You know, the trick is to persevere, approach the process with some self-compassion, allow for that reflection, that change, flexibility between different techniques and interventions, and just try some things out. Okay. I want to talk about self-care, or maybe what we perceive as self-care. So what do each of you define as self-care? I want to do a little activity. You know, you can think about it in your head, you can type it on your phone, you can write it down. So let's take a few to really think about what self-care means to us and how you practice it. So go ahead and think of some examples that keep you sane in your life that you would perceive as self-care. All right. We get a few down. So now that you've written a list of, you know, self-care ways and activities you enjoy, let's make a list of activities you feel help you thrive and feel well as an individual. So some of these examples can include staying hydrated, moving your body, sleeping 8 hours per night, eating a well-balanced diet, putting your needs first, saying no, that's a hard one, setting boundaries, staying home, maybe learning how to forgive yourself. So write down some of those examples and then we'll come back in a second. Okay, you have a couple things written down. So I want you to take the self-care list on the previous slide and the needs list. Take a look at them. How do they compare? Are they similar? Are they totally opposite? I know that when I did this, they were not the same. They were not the same at all. So maybe they are the same, maybe they're not. Maybe what we perceive as self-care actually is not self-care at all. Maybe they are band-aids for the things we also ignore because we are so caught up in life. I am 100% guilty. You know, it's really hard to take care of ourselves and still maintain being a priority. But I promise you guys, it is worth it. You know, while the other things are really nice, like baths, face masks, coffee, you know, those quick things that we say, oh, I'm doing a face mask and watching Netflix or eating pizza, or oh, I'm going for a run, or, you know, things that we don't do very often, but we think they're self-care. You know, maybe it's really time to dig deep and see what our bodies and minds actually need to thrive and to be taken care of. So in today's world, we are literally pressured to go nonstop. Like I was telling Maggie before everyone logged in, my life is 0 to 100 all the time. You know, we're going. We often neglect our needs. So frequently, you know, when we get that coffee, when we take that nap, oh, like we feel like we are really taking care of ourselves. Like I just took a 20-minute nap. Like I'm so good now. You know, have you guys ever wondered if we actually are just implementing self-care practices or basic human needs that are often so ignored, we have then conditioned ourselves into thinking we earned them? Like, I know I've done it. I'm like, "Ugh, I just earned this nap. I just earned the right to take a bath." Like, what? You know, we're so caught up in life that we don't recognize these things that we're doing. So, in other words, you do not need to earn the right to take care of yourself ever. This is a need. And I hope that your list you wrote out with your needs, that you will be able to incorporate some of those into your quote self care time to really, really take care of yourself. So I love this slide. It's kind of cheesy, so bear with me. Mental health is like an onion. You know, it is painful as you cut through each layer. It can make you cry. It can be super frustrating. It's very, very unpleasant at times. And it can be pretty predictable with new onions. You don't know, you might have a really, really strong one, and you might have one that, like, you're good, doesn't phase you. I cannot stand to cut onions. I really struggle. I'm that person that has to have the water running. I have to like sometimes put safety goggles on because I am a mess. Like they just burn so bad. So, what do we know or what can we gather about chopping onions? We know that it improves with exposure and with time. It really does get better. You can learn to utilize your resources, your coping skills, therapy, medication, group support, all of these things we just talked about, that square breathing. You know, we want to minimize and work through the pain, anxiety, and the stress that each of us experience at times. So that's me. Mine is the water and the safety goggles. And just really ask yourself, what do you need to cut through that beastly onion? I told you it was total cheese ball. So now let's talk about some tips on staying motivated. So a little recap on the next couple slides from the last lecture I did in the fall in case you missed it. If you were here, you can just take a minute and coast, whatever you're comfortable with. So as we all have been experiencing, you know, the motivation is super low. The feelings and the burnout is high. Burnout is real. Burnout takes a toll on all of us, no matter what career we're in. It's hard to stay motivated, okay? So some ideas for keeping yourselves motivated is to, you know, create a routine and follow it closely. You can type up a daily habit tracker to keep track of things that you need to do, like maybe you know, make a little check mark every time you drink water, or, you know, do a little lap. Maybe you have an Apple Watch that records your steps, some type of routine to help you stay consistent. Maybe you're setting a timer with an allotted of time to do or think about XYZ, because I know that our minds like to just go down rabbit holes and then it's been 3 hours and we're just like, I had just sat here for 3 hours. So set that timer, okay? Hold yourself accountable to a checklist or get a buddy. Make it a team effort, have a group text, check in on each other, plan something fun to look forward to. What's your favorite meal? A hobby? What brings you joy? You know, reward yourself, and this is not self-care. Reward yourself for accomplishing tasks you have set out for yourself. It doesn't matter how big or small, they all count and they're all very, very important. So some days are just not going to go as planned. They are going to be absolutely terrible days, but that doesn't make you any less of an individual. Maybe you just need to lay in bed. Maybe you need to lay in bed all day. Maybe you need to skip that workout. Maybe you need to just indulge in those extra treats or the comfort food that you didn't plan for. That is okay. It is very important to be flexible and to not feel the need to really be 100% every day, because the truth is none of us are going to be 100% every day. We can't. It's not possible, and we shouldn't be. Your best version of yourself is going to look a little bit different every single day, especially given, difficult situations or circumstances that are going to arise. You're not the same individual you were a month ago, 6 months ago, last year. We evolve and we grow. So I want you to be kind to yourself and really just lean into what you have been given with that exact moment and evolve with it. So physical health impacting mental health. I think, this whole stigma we have been talking about, people put them in separate categories. It's like, I just broke my bone. I need to go have surgery now. That's physical health. And mental health is over here. The truth is they're very, very closely related. They actually can really affect one another. How does that happen, So I like to always remind people how closely related these are. Your mental health and how you feel emotionally directly influences how you're going to feel physically. How you're going to physically get out of bed each morning, that is going to take a toll on your mental health, or, if you're feeling really, really sad, maybe you don't have the energy to work out. They're very, very closely related. Physical feelings, physical health is going to impact your emotional state. So some ideas to put your health first that are shown on this slide. Some of these may seem pretty straightforward, but sometimes it's so easy to forget to do these things or even to make them a priority. Following a routine, setting an alarm, repeating those daily habits for consistency. We are creatures of habit, and having that sense of familiarity can be very, very helpful for us. Maybe keeping a clean and organized home environment. It's much easier to feel super anxious and overwhelmed when you're in a very cluttered and disorganized environment. Keep your workouts going. And if you haven't been doing that, that's okay. Like, you can always start today. It's never too late. Maybe you have home equipment, maybe it's virtual, so you're looking stuff up on YouTube. Something you enjoy, something where you can find that mental release in. It's hard to stay motivated, but I promise you will feel better afterwards. Okay. You could take a long walk around your neighborhood. Maybe you're going to do some body weight exercises, push-ups, pull-ups, squats. Maybe you're going to have a paid gym membership or a paid app that kind of tells you what to do. Or there's always free. I love free resources. Like, YouTube is amazing. Like I said, Zumba, cardio, yoga, stretching. This does not have to be full blown, like killing yourself at the gym. Just move your body so that you can achieve wellness. Trying to stick to a meal schedule and stay hydrated sounds pretty easy. I know I'm super guilty of drinking water. I feel like I never drink water, and I probably would feel a lot better if I did, So really remembering to do that. Have a little alarm on your phone that goes off so you remember to drink that water. Or if you're familiar with MyFitnessPal, you can log your food. If that's too stressful for you, don't do it. We don't need to add more stress, but if it's helpful for you, then you can do it. Try to do your best to balance your diet, because what we eat can really impact how we feel. If we feel sluggish, or maybe we feel super energized and good, adequate protein, vegetables, and then limiting those processed and sugary foods. But of course, we all need treats. Like, anyone who tells you to never eat a treat again, that is not okay. We need our treats. Sometimes we just need that comfort food to get us through. So continuing to talk about this, take care of your mental health, everything that we have been talking about. Giving yourself breaks from the news, from social media. It's super overwhelming. It's super toxic at times. People solely show their highlight reels, and that really pressures us into attempting to live lives with very false expectations. And that can really take a hit to our mental health. Meditate, engage in activities that help you decompress and actually make you happy. You don't want to be doing stuff as a chore because someone said to do it. Do it because it matters to you, because it makes you feel good. Engaging in video chats, conversations with your friends, family, loved ones getting adequate sleep. Sleep is huge. Sleep affects everything: mood, appetite, how you're thinking, energy, and going without sleep for a long time can really take a toll on your physical health as well. So some tips for helping you sleep. I became a master this last year when I worked the graveyard shift and I felt I was never sleeping. So these are some of my favorites. Making sure your bedroom is quiet, dark, relaxing. Make sure it's not too hot. Maybe you like to sleep with it hot, but cooler temperatures can typically help you sleep better. Maybe having a little light snack before you go to bed rather than something heavy. Avoiding caffeine and alcohol prior to bedtime. Avoiding screen time a few hours beforehand, and being consistent. Going to bed at the same time each night and then getting up in the morning. I know that's not always possible because life happens and we have to adapt, but schedules can be very, very effective. So this is one of my favorite slides. I just love this picture because to me it looks peaceful, it looks freeing, and I feel like mental health should be that way too. I know it's dark and it's scary and it's overwhelming, but having a support team, having people who want to help can make it light, make it doable. So wrapping up, as you guys can see, advocating on the importance of mental health is very, very important to me. I see a lot of individuals hurting. They're feeling ashamed. They're really spiraling down because of what they are feeling and for what they may be experiencing. So I want you guys to focus on what you can control rather than what you cannot. And that is challenging. Do not discredit how you are feeling or compare yourself to others. Your feelings are valid. You're allowed to feel this way, and you don't need to explain yourself. You just don't. Everyone is going to be experiencing something unique and everyone's going to cope differently. So it's important to acknowledge our thoughts and feelings and to begin working through them, and to know that there are individuals like me cheering for you, sending you all the courage to take that first step. If you need help, or maybe things are a little bit more challenging, maybe you don't quite feel yourself anymore, reach out for support. And, it is quite crucial at this time, especially last year, but now it is too. Reach out, call, text, video call someone who is important to you. And most importantly, be kind to yourself. Remember, this stigma and judgment that floats around has nothing to do with you, and it has everything to do with our society. Our society has continually led us to believe that there was ever anything wrong with being open and honest regarding how we feel and seeking out help to better our lives. We deserve that. Each of you guys deserves to be happy. And like I mentioned, this last year has really tested us, and it seems like it's still coming in other ways. So take that time off, turn off your phone, limit the news, limit social media, set those boundaries with people, make yourself and your needs a priority, seek out mental health services, take time to process what you are experiencing, go to therapy if you would like to, take that medication if it's going to help you, reach out for help, do whatever you need to do to get through this time and really any stressful time that's coming. It's okay to pause. I know we're built to be machines and just go, 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 but it's okay to pause. You are not less of a person. So this slide is one of my favorites to keep on hand. It's hearted in my phone so that I always have it in case I need it, someone else needs it. There is a little icon picture that will be emailed to you with the PowerPoint. So you don't have to take a picture of this. If you want to, you can. But there is always help out there. Even when you or someone you may know may feel completely alone, there is always somebody to turn to. There's always somebody waiting for you if you're ever in need. This list is quite extensive. I love it. It has everything. I put it together last year and it has been so beneficial. I've actually pulled it up multiple times to help people. These conversations that are happening within these text lines, hotlines, substance abuse lines, suicide prevention lines, these are all confidential and they're all free. It has everything and anything you might need. Remember, you guys, you are not weak for seeking out help. Ever. You are brave, and it takes a lot of courage to put your needs first. So I want you to send that text, make that call, do whatever you have to do, and please do not be ashamed. Just do not be embarrassed. Mental health is real, and everyone is affected by it, and it's very, very normal. So we made it through the PowerPoint. Thank you guys so much. I just want to take this time to open up. If you guys have any questions, I'll answer anything that you would like to know. You can also email me. Here's my email. I also am pretty active on my social media. It's kind of a cheesy title, but I do a lot of mental health outreach and advocacy on there. Like I said, you'll have access to this PowerPoint and that icon with the hotlines and resources. It has been such a pleasure to speak with you all again and be here. So please don't hesitate to reach out if you need me, if you have questions. Yeah, thank you.
Thank you, Ariana. Do we have any questions? Or if you want to reach out to her directly, there's her information. We will be sharing this PowerPoint and we're actually recording. So if you want a copy of this, just let us know. We can send it to you via email. And once we're done with this, we will be sending the PowerPoint and her information as well. Once again, Ariana, thank you so much. You know, the first time and the second time, I mean, there was stuff that you said, but I didn't resonate until today. So I think just having this, knowing that it's okay and it's normal sometimes to feel like we're not doing enough or that we're angry or that, you know, just having a blues day, it's okay. But reaching out for help, or if you know of anyone, I mean, just talk to them. I mean, sometimes it's just people need to be heard and we forget about that because we're always on the go, 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 go. We forget to hear people. So thank you so much. Any comments? No? Once again, thank you. I see someone's clapping their hands.
Thank you guys so much. Thank you, Maggie. Yes, you guys are never alone. I know it feels like we're alone sometimes or that nobody cares or we don't want to burden somebody else's life, but you're not a burden. Every single one of you matters. And we're always here. We're always here to help. Someone is here cheering for you and wanting you to live your best life possible. So thank you guys again so much. And please email me, reach out to me if you want to talk about anything. So always here.
Awesome. Thank you. Thank you so
Thank
much,
you.
guys. Thanks for taking the time and actually, you know, I know everyone's busy, but thank you guys for being here with us today. Appreciate it.
Yes. Thank you guys.
Thank you guys.
Thanks, guys.
There's no
Bye-bye.
more questions or concerns or comments. We'll let you guys get back on your day. So thank you so much once again for joining us.
Yeah.
Thank
Have
you.
a great day.
Thanks.
Thanks, you too.